Deb, would you be so kind as to tell our viewers what is the Hensley Behavioral Health Unit?
It is a specialized program for the older adult. We deal with depression, bipolar, schizophrenic, schizoaffective disorder, different stages of dementia.
Okay.
And we provide a structured program.
And Dr. Foster, you're a psychiatrist, so that would certainly fill the bill for everything that Deb has just described as far as what it is that you do. And how is the program structured? What would be let's say a patient comes into the unit, what would the next step be?
Well, generally, obviously there's a process that they go through to get admitted, and once they're admitted, they'll generally see me, and I'll do an evaluation on them and attempt to get a diagnosis that we're working on treating. And once we know what we're treating, we come up with a treatment plan. And that can include medications, it can include talk therapy, it can include activities, it can include family meetings. And we individualize that treatment plan based on the problems that the patient's having and based on their particular circumstances.
May I ask, what are you seeing a lot of in this area, in the Twin Lakes area?
Well, obviously in the community we have a lot of older people and a lot of retirees, and in the older populations we tend to see a lot of dementias. Certainly we also treat other things, but given the older adults in our area, I think there's a high prevalence of dementia.
And Ms. Crystal, now how would you fit into this with the nurse, as the nurse director?
So I oversee the nursing aspect of the unit, scheduling, ensuring our care is delivered to the quality that we want and expect, ensuring staffing.
Make sure everybody really understands how to, the best approach for very special patients.
Right. Yeah. Like Dr. Foster was talking about, the treatment plan and plan of care, making sure our plans of care are in place and that we're meeting our goals with those.
Well, and Deb was talking, we were talking earlier before we started the show about how someone is admitted. Now, where would a candidate come from?
Right now we do direct admits, which I'm very proud of, from any physician's office, a nurse practitioner, a clinic. From the nursing home we can do a pre-admit direct, where we can then do a medical assessment that Dr. Foster would want certain things like a UA and a chest x-ray and things of that nature. So we can streamline that and get our admissions just about from anywhere. You can actually just go to the ER and explain, you know, what you need or what your concerns are, and they assess and they'll call us.
And you said that now, like with nursing homes, do you ever go on site?
Oh, I do. I go on site and do screens on site.
Okay. All right.
And then when I'm out marketing, I do follow-ups with the people that we've discharged back to see how they're doing, see if there's any issues that I can help them with while I'm there, that kind of stuff.
So if someone's behavior is way out of control, it might be something as simple as a urinary tract infection versus some kind of mental challenge right now. So that's why you request all of those things first. Make sure, kind of process of elimination, find out what it isn't, then you know what to start looking for, what it is. Is that a fair assumption? Okay. All right. So you've got all your folks upstairs, and that is a secured unit for the patient's safety. And talk to us more about, like, if you're a family member and you have a loved one that you're very concerned about, what can they do? Can they actually call you?
They can call
talk
the
to
unit
you
directly.
Yeah. Okay.
They can call us, and we get a lot of phone calls this way, Donna, where they want to talk to you about, my mom is doing this, or my dad is doing this, or I've noticed this in another family member. And we talk them through it, and we usually encourage them, if it's not, excuse me, in a crisis, to go to the regular doctor. Just go ahead and make an appointment and go to your primary care and start the process there. Now, if it's a crisis, like they're crawling out of the window or they're running away from you, then yes, take them to the ER. And then that's when we get involved. And there's times when they go to the primary care doctor that they will send an order to me, and then I can go into the home and assess the individual in their regular environment.
Okay.
And that's usually a good approach, because I think without the stress of being an ER or in your doctor's office, you get a clearer picture of where the deficits may be.
What is they laughingly called the white coat syndrome? Oh my goodness, no! I do that in the dentist office. And he says, your blood pressure's a little high. Yes, I'm in the dentist office, you know. So,
That's true.
And you're right. If you get within your own environment, it's going to be so much more relaxing and familiar. But I can think of, I remember years ago, a woman with dementia, and the family, when they came during the holidays to visit, started noticing piles of newspapers and piles of mail and piles of a lot of notes, little Post-it notes, and suddenly realized Mom was not quite where she used to be.
Right.
So they knew that they needed to intervene and do something. So they did. They started with her primary care physician and realized that there were some challenges. So, but this would be then a person that you could help. Yeah. Yeah. What's the length of stay usually? I know that's kind of a real ballpark question. What's
10
the
to
length of
14
stay?
days.
10 to 14?
It varies depending on how the patient's doing, you know,
Yeah.
and what they're admitted for, but generally around 10 days is, you know, not unusual. Sometimes people come in quickly and then they leave in a few days, depending on, you know, on how they do. If they improve quickly, then sometimes they don't need to stay that long.
Yeah.
And it depends on their situation at home and what they need in terms of supports and what we need to do to discharge them safely.
Do you work with all the family? Do you bring the whole family together?
We generally try to
Yeah.
involve as many family members as is possible or practical. As many of them will want to be involved, certainly. And we generally try and have at least one family meeting with each patient's you know, family members, so that they can come in and we can talk about what we've done and what our plans are and any concerns that they might have, and
Sure.
answer any questions that they have as well.
And how maybe not to exacerbate the initial problem again, how to stay away from it, you know, what habits need to be changed or what behaviors need to be changed by everyone.
Right.
Yeah.
So particularly with the dementia patients, you know, the family a lot of times do need help in terms of educating them in terms of how not to make the situation worse sometimes. And so there's certainly a lot of education that can be helpful.
I've heard of many spouses that, whether it's denial on their part, this I'm referring to the quote healthy spouse, you know, oh, she or he is just doing that to be ornery. They're just acting that way to get attention. They're just, you know, because they don't want to accept it or
Right.
deal with it, or, you know,
Or don't
D, all of the
understand
above. Yeah, yeah, just not educated enough, Crystal. You're right. So what a great service, because I know that, as you said, with such a huge population, well over 65 here, and with dementia, unfortunately, attacking, you know, showing up more in that particular population than others. Yeah, we've got a high incidence rate here. But how far out do you travel? You'd mentioned, and you know, we always think of Baxter County, and we'll throw in Marion County.
I do Fulton, Izzard, Stone, Harrison. What county is that? I go down to
Boone.
Boone, Marshall, those areas. I go into Missouri. I do West Plains, Thayer, all the way up to Ava.
Wow.
Because we get referrals from the little communities that are in that area. Lots of times they may go to OMC, and then OMC will refer them over to us.
Right, right. And the insurance is covered, whether it's Missouri or Arkansas, it doesn't seem to matter.
Since we're right on the state line, there's a range there. You just have to notify, like if it was a Medicaid, you have to notify the state of Missouri, but then you can bring them.
Yeah, they don't put up any fuss to have you, send them back to us. No, that's our state. Yeah, that's our patient.
No, they're really very good to making sure that the individual goes to the most appropriate setting for what they need.
Great. Yeah.
And that's a big plus.
Sure, sure, because that's not a huge distance to travel, and there's not a lot available. Are we one of the very few for quite a
for a
few
good
miles?
distance, for
Yeah.
like Missouri, like Thayer and Mountain Grove and those areas, we're probably the closest. And then Harrison tends to go to the western side of the state. Batesville tends to go to the more of a southern area for them. They don't tend to market a whole lot up here.
Yeah.
So we kind of divide it up based on where these three little hospitals are community-based.
Right. And it is so necessary. I think, Dr. Foster, you might agree with me on this, and that is, mental health is just one of those, here's the carpet, let's brush it under and not deal with it. For years, I mean, we've just not had people paying attention, perhaps like they needed to, with
Right.
mental health issues of all ages, for all ages.
Unfortunately, I think that's still the case, in terms of policy and public awareness and treatment availability in many areas, not just here, but throughout the country. I think we still have a long ways to go in terms of, treating mental illness.
And the stigmatism, I suppose, is still there. I'm weak if I have to go.
It's still alive and
Yeah,
well.
Well,
unfortunately.
yeah. Unfortunately healthy, yeah. So I hate to hear that because, we all need mental health days, doggone.
Oh,
I mean,
yeah.
that's, some people call them vacations, but yeah. We all need them. We all need to take a break from what we do. And especially because you're dealing with such a special population. We're very blessed to have all of you at Baxter Regional Medical Center that take such good, compassionate care of folks that are dealing with something really, in many cases, beyond their control.
True.
So we are going to take a short break. Don't go away. We'll be right back with more of BRMC's Healthy Connections.